Hello everyone, welcome to Good Morning America Health. I'm Tanya Rivero. A recent study is shedding new light on just what it takes to survive the terrifying onset of a heart attack. Would you know what to do in this harrowing circumstance? Now with more on this is the Medical Minute.
Sudden heart attack survival rates are dismal. About 300,000 people suffer sudden cardiac arrest outside hospitals in this country every year, but only 1 in 10 survive. And that statistic has remained steady for the past 30 years. Now there may be a way to increase that survival rate. Dr. Camilla Cesson with the University of Michigan Health System says her research shows that cardiac arrest survival chances depends on what part of town you live in. Her study of heart attack victims in Fulton County, which includes Atlanta, found that residents of economically disadvantaged and less educated neighborhoods were 2 to 3 times more likely to have a heart attack than residents of more affluent or educated ones. Even more troubling, residents of poorer neighborhoods are less often trained to perform potentially life-saving CPR. Dr. Sasson suggests that health officials should target neighborhoods that have high heart attack rates and need CPR training the most.
And now we turn to a silent problem that plagues an estimated 100 million Americans. We are talking about the scourge of acid reflux. But did you know as many as 80 million of these sufferers go undiagnosed? Here to get to the bottom of all this is our chief medical editor, Dr. Timothy Johnson. Dr. Tim?
Thank you, Tanya. And joining us to talk more about acid reflux and its surprising, sometimes silent symptoms is Dr. Jamie Kaufman, who is a physician and founder of the Voice Institute of New York. We thank you for taking the time to join us today.
Good morning, Tim. Thanks for having me.
So remind us of both the classic symptoms we often hear about when it comes to acid reflux and the silent symptoms we often do not hear about.
The term silent reflux is relatively new, and it's just now sort of striking the public's awareness. Heartburn or crushing chest pain after particularly a big, heavy, greasy, fried meal, people are aware of. You see these ads on TV and so on. And indigestion as well. But it now turns out that hoarseness, a sensation of a lump in the throat, difficulty swallowing, too much mucus all the time. You hear people clearing their throats all the time. And finally, cough. Cough is actually a big symptom of reflux disease, and particularly people who wake up in the middle of the night or seem to be throat clearing, coughing both all of the time. These are very, very, very prominent symptoms for refluxers.
And since they're so common, how does the average person or even the average doctor know that they're caused by reflux or something else?
Well, one of the problems is that these patients often go from doctor to doctor without a diagnosis, because what happens, for example, with the chronic cough patient is they go to the doctor, for the lung doctor, and the lung doctor says the lungs are okay. And so they do sometimes go from doctor to doctor. Sometimes people will figure out, gee, there's something in my diet. We know, for example, that kids who drink a lot, the next morning they'll have a lot of reflux symptoms, particularly cough and hoarseness and sore throat. And they'll be aware of that, and they may take antacids those days. But silent reflux excuse me, is one of those symptoms that is not easily diagnosed today. And I think public awareness is important.
How important is it for a person with these kinds of symptoms to get a very precise diagnosis and testing versus trying some of the tricks or some of the avenues to lessening the symptoms that you can recommend?
It's a difficult question to answer. Right now, the fastest growing cancer in the United States is esophageal cancer. It's related to reflux disease. There's a precursor called Barrett's. We're seeing it in 7 to 10% of our patients that have hoarseness and cough and throat clearing, which is really the same as people who have indigestion and heartburn. So the real question is, how do we know who needs to be evaluated? I would say anyone who has persistent symptoms for more than 6 weeks, or symptoms after an upper respiratory infection of more than, say, 8 weeks, really should be seen by a doctor and have an examination. And examination of the esophagus is one thing, but also examination of the throat, and look for the symptoms and findings of reflux laryngitis as well as reflux esophagitis.
Now, I know you're big on dietary change as an approach to treating this condition, so with the couple of minutes we have left, talk a little bit about diet.
Well, we know that reflux is a little bit complicated, that there actually is an enzyme called pepsin that gets stuck on your tissue when you reflux. And people are always talking about acid, acid, acid. And the reason why there's confusion is pepsin requires acid activation. So what we found over the past few years is when you have reflux and pepsin in the tissue, the dietary acid is equally harmful as continued reflux from below. So what we're saying essentially is things like carbonated beverages, soda pop, even citrus are problematic. And finally, there's this big question about prepared food. It turns out that the Food and Drug Administration uses acidification in manufacturing practices that are generally accepted to kill bacteria. So almost everything we eat that comes out of a bottle or a can has been profoundly acidified. As a matter of fact, even baby food today.
So you would say to people who are having these kinds of symptoms that you've described that it's certainly worth trying to change your diet as a first step.
We call it a pepsin detox or a washout, and we're recommending for our patients, even those that are failing on medical treatment, 2 weeks of a low-acid, low-fat diet. That means no fruit except for melons and bananas, nothing carbonated, and stay away from all prepared canned fruits in particular. Applesauce, for example, is acidified to the same level as stomach acid.
Very interesting idea, and something that I'm sure a lot of our listeners are going to pay attention to. So we do thank you again for taking the time to join us this morning.
Thank you.